Join me as I dive into the challenge of figuring out what to do when breast milk just won't flow. One of the most frustrating and anxiety-provoking experiences for many breastfeeding mothers is when their breast milk just isn't flowing. It's more common than you might think, and it's essential to understand that you're not alone in this struggle. When breast milk isn't flowing, it can be a really challenging and emotional experience for mothers. Not only can it lead to feelings of inadequacy and guilt, but it can also be physically uncomfortable and even painful. Additionally, it can impact the baby's ability to latch and feed, leading to further frustration and concern. Furthermore, the pressure to produce milk can create a sense of anxiety and stress, which can actually make the problem worse. And on top of all this, the lack of milk flow can also lead to feelings of isolation and disconnection from the baby. Mothers often feel like they're doing something wrong, that they're not good enough, or that their bodies are failing them in some way. It's essential to recognize that these feelings are normal, but they're not necessarily based in reality. Breast milk supply issues can happen to anyone, regardless of their intentions or efforts. And what's more, these challenges can actually be overcome with the right strategies and support. When it comes to breast milk supply, there are many factors at play. One of the most significant is stress. When we're feeling anxious or overwhelmed, our bodies can actually suppress milk production. Diet is another critical factor. A lack of nutrients or a poor diet can impact milk supply. And then there's the way we breastfeed. A shallow latch or an inefficient feeding technique can also affect milk flow. But here's the good news. These challenges can be overcome. For example, taking steps to reduce stress, such as practicing relaxation techniques or seeking social support, can really help to boost milk supply. Eating a balanced diet that's rich in nutrients, particularly galactagogues like oats and fenugreek, can also make a big difference. And finally, working with a lactation consultant to optimize breastfeeding techniques can help to improve milk flow and overall feeding efficiency. I want to share with you a powerful story from a mother who overcame breast milk supply issues. Sarah was struggling to produce enough milk for her baby, and she was feeling anxious and defeated. But with the support of her healthcare provider and a lactation consultant, she was able to identify the root causes of her supply issues and make some critical changes. She started practicing relaxation techniques, adjusted her diet, and optimized her breastfeeding technique. And within just a few weeks, her milk supply had increased dramatically. Sarah's story is a testament to the fact that breast milk supply issues are not insurmountable. With the right strategies and support, mothers can overcome these challenges and go on to have a successful and fulfilling breastfeeding experience. Sarah's story also highlights the importance of seeking help and support when you need it. Don't be afraid to reach out to your healthcare provider or a lactation consultant if you're struggling with breast milk supply. To summarize, breast milk supply issues are common, but they're not inevitable. By understanding the factors that can affect milk supply, and by seeking the right support and strategies, mothers can overcome these challenges and go on to have a successful breastfeeding experience. Thanks for watching, and I hope this video has been helpful in addressing some of the common challenges associated with breast milk supply. If you've had experiences with breast milk supply issues, please leave them in the comments below. I'd love to hear from you. And if you're looking for more breastfeeding tips and advice, be sure to check out our next video, where we'll be discussing some more essential strategies for breastfeeding success.